So when we talk about treatment for IIH, a lot of people try not to treat people with IIH and pregnancy, and that is absolutely wrong. There's absolutely no reason people in pregnancy should suffer from constant headaches. The treatment goal is so we can relieve the pressure in the brain and preserve vision, because obviously if you have more and more intracranial pressure, which is putting more pressure on your optic nerve, that can be detrimental and can lead to issues with vision and blindness. So we want to make sure that patients are being monitored very closely during the pregnancy, and that we're doing things to preserve vision and relieve symptoms, particularly the symptoms of a headache. Symptoms of a headache tell us something is still going on. We still have increased intracranial pressure there that we need to address. And so the treatment goal is to preserve vision and relieve symptoms, particularly the symptom of a headache, because that's the telltale sign that we monitor for during the pregnancy. Now, pregnant women should be managed and treated the same as people that are not pregnant, with a few exceptions that we'll get into. So for the most part, if you were doing something before pregnancy for management and it worked, usually we continue that during the pregnancy unless you're on medications that are contraindicated. So anybody that has IIH during the pregnancy, I would recommend a preconception consultation with your OBGYN or someone that does high-risk pregnancies, like a maternal-fetal medicine specialist like myself, so that we can go through all of your treatment regimen to make sure you are on stuff that is safe in pregnancy. And the reason this is really crucial is people with IIH present in the childbearing years. These are people that are 18 to 35 that usually present and get diagnosed with IIH. Well, those are usually the times that people are getting pregnant. And so we want to make sure that any treatment that people get, whether you're planning for pregnancy or not, they honestly should all be pregnancy safe, because anyone can get pregnant in those crucial years that are the vital times of diagnosis of IIH.